background so that we don't have background noise that interferes with everyone hearing the presentation. You probably just now got a notice that this webinar is being recorded, so just be aware that this is being recorded, and that if you ask a question at some point, you will be recorded, and it will be posted on the AWHONN website for later playback. We will have a question and answer time at the end of my presentation. You can ignore the part about submitting questions via the Q&A application. That application is not available on this presentation. But you are also welcome to use the chat feature to communicate with each other during my presentation. I'm not that good a multitasker, so I won't be able to check the chat while I am speaking, but feel free to communicate with each other. AWHONN does have a code of conduct for participants in these webinars. You can find it on the AWHONN website. I will not review that whole thing, but just be aware that we do expect you not to harass or intimidate other people during the course of the webinar. We're not really able to help you with technical difficulties during the webinar. We just suggest that if you have difficulties, try using a different web browser and logging in again. And of course, there are no nursing contact hours available for this presentation. If you think of a question after the presentation is over, or if we have to complete, if we have to end the presentation before we get to your question, feel free to email advocacy@awhonn.org. I or someone else will get back to you. And I, of course, am Seth Chase. I'm the Government Affairs Director at AWHONN. So here's what we're going to go over this afternoon. I'm going to describe for you the process for determining. Please mute your line. I'm going to describe for you the process for determining policies and legislation that AWHONN supports. I'm going to give an update on legislation in Congress this year that we're working on, and I'll describe opportunities for member involvement. So AWHONN's advocacy flows from the AWHONN mission. And I hope you're familiar with the AWHONN mission. Just in case you're not, here it is. And that is to empower and support nurses caring for women, newborns, and their families through research, education, and advocacy. Now, ignore for a minute that it actually says advocacy in there, and just consider the first part: to empower and support nurses caring for women and newborns and their families. There is only so much that AWHONN can do through research and education to empower and support nurses. At some point, we have to ask the government to do something as well. And I can think of a couple of easy examples to explain. One is across the country, on average, half of childbirths are paid for through Medicaid funds. When a pregnant woman who does not have health insurance seeks Medicaid, she has to meet a lower economic threshold because she's during her pregnancy than she would otherwise. But she's only eligible for Medicaid coverage until 2 months after she delivers. But we know that women develop serious illness and sometimes die from pregnancy-related causes up to a year later. So one of the things AWHONN is working on is passing legislation that would require Medicaid funds to cover women up to a year postpartum. That's something we can't do without asking the government to get involved. Also, as I'm sure all of you are painfully aware, there is a shortage of nurses in this country. And we can only do so much through promoting the nursing profession on our own to increase the supply of nurses to staff our hospitals. We really need the federal government to get involved, and we work on that as well. So that's how and why AWHONN's advocacy flows from the AWHONN mission. Specifically, we have written down the positions that AWHONN advocates for. The images you're looking at on the screen Here are the 2 pages of AWHONN's 2022 federal legislative and policy agenda. I'm sure the print is too small for you to read. If you are not familiar with this document, I encourage you to look it up and give it a read through so you have a better idea of what specifically AWHONN advocates for. And I've given you the trail of breadcrumbs on the screen. Go to the AWHONN website, find the media advocacy and journals drop-down menu, click on advocate, and then click on the 2022 legislative priorities link on that page. And this document will come up for you. We also have position statements, and those are also used as sources to justify advocacy for specific public policies. And again, I've given you the trail of breadcrumbs there to find that page. Both position statements and the federal legislative priorities are board adopted, and that's what makes them official positions of AWHONN. And I'll talk a little more in a minute about the process that leads to board adoption of positions. I do have a strategy that I follow that I believe makes us most effective with what we have to work with, and that is to influence public policy by establishing AWHONN as the principal authority on maternal and newborn nursing care by leveraging AWHONN membership, research, and nursing workforce education training programs. And I'll talk later how you folks might fit into this strategy. So here's the players on the AWHONN advocacy team. AWHONN has a public policy committee. I work very closely with them. They are AWHONN members who are appointed by the board of directors to serve in that committee. They're like a study group for the board. So they make recommendations to the board of directors, and that includes the positions. Those recommendations include the positions that AWHONN supports. So the document I showed you a moment ago, the legislative priorities, that is a document developed by the Public Policy Committee and then was sent to the board of directors, who during one of their meetings discussed it and decided, in this case, they decided to adopt it. And so they voted on that and it became official AWHONN policy. And of course, I've now just described to you the board of directors role. We have in most of our sections a point person on advocacy who we call the legislative coordinator. I will talk a little more in depth later in this webinar about their role, but essentially they are the person. They are. I like to think of them as AWHONN's lobbyist in their state. There's the government affairs director. That's me. There are a couple other staff who work part of their time on AWHONN's advocacy and public policy. I am tasked full time to advocacy and public policy. And then of course, there's the general AWHONN membership. You all play a role by participating in our advocacy, by contacting your elected officials. So I'd like to talk a little bit about what we accomplished last year. The Protecting Moms Who Served Act passed Congress and became law. That is a bill that requires the Veterans Health Administration to upgrade maternity care services to women veterans who are receiving maternity care in Veterans Administration facilities. In April, the House passed the Workplace Violence Prevention for Healthcare and Social Service Workers Act. I'll talk a little bit more about this bill in a minute, but it passed the House. It is not law because it has not passed the Senate. The Biden administration and the Department of Health and Human Services issued a final rule on Title X Family Planning Program, the Title X Family Planning Program, that restores access to planning services. You may know that during the previous administration, the Trump administration, restrictions were put on the use of Title X Family Planning Program funds. They are not allowed to be used to pay for abortions, nor are they allowed. They're not allowed to be used to pay for abortions. The restriction placed on the use of those funds by the Trump administration prohibited organizations receiving Title X Family Planning Program funds from even telling patients where they could seek an abortion. The Biden administration has reversed that rule. This is something we did comment on when rules are created by federal agencies. There is a notice and comment period that goes into effect. It's a 60-day period, and we do provide comments on those proposed rules during that process. And so before rules are finalized, the agency has to look at all those comments and take into account whether or not the rule as written is a good idea based on those comments. And in October, the Providing Urgent Maternal Protections, or PUMP, for Nursing Mothers Act passed the House. Again, it has not passed the Senate, and we'll speak specifically to that bill more in a minute. So I'm going to talk now about some of the legislation we are working on. This is not an exhaustive list. There is a lot of bills that come to my attention specifically, and often we take actions on many of them, and we may take a variety of actions. These are sort of the highlights. These are the most important bills we're working on. So there's a bill called the Black Maternal Health Omnibus Act. It is a very large bill. It's an unusual bill in that it assembles several other bills, specifically assembles 12 bills. I'm not going to read all of the bullets here. I hope that you're looking through them now. This bill covers many different areas of attacking the crisis of Black women in pregnancy and childbirth. As you may know, Black women are dying from pregnancy-related causes at roughly 3 times that of white women. So we have a problem, and this legislation seeks to address it in many different ways. It was introduced by Representative Lauren Underwood, who represents a district in Illinois. It currently has 167 co-sponsors in the House and 29 in the Senate. There are 435 members of the House, and of course 100 in the Senate. So this is significant in terms of the number of co-sponsors. And we'll move on. The Perinatal Workforce Act. It would establish programs and require research to diversify the perinatal workforce and advance respective maternal care delivery models. It would require the Department of Health and Human Services to award grants to education and training programs to grow and diversify the professions that make up the perinatal workforce. HHS would also disseminate guidance on respectful maternal care delivery. And the National Institutes of Health would study best practices for culturally congruent maternity care. Now, just a little more about this bill. As I just said about the Black Maternal Health Omnibus, that assembles 12 bills. This is one of those 12 bills. And we're working both on the larger package, but specifically on some of the bills that make up that package, especially ones where we have a distinctive contribution to make, which we certainly do on this bill, that seeks to expand and diversify the perinatal workforce. This bill was introduced in the House by Gwen Moore from Wisconsin, and in the Senate by Tammy Baldwin, also of Wisconsin. It has just 35 co-sponsors in the House and 2 in the Senate. I'll talk more later about what we're going to do to improve upon that. Here's another bill we're working on, the Moms Matter Act. Would make investments in programs to support moms with maternal mental health conditions and substance use disorders. It would also provide funding to grow and diversify the maternal, mental, and behavioral health care workforce. And we are supporting this bill because, according to the CDC, mental health conditions are one of the leading causes of pregnancy-related death. And it was introduced in the House by Representative Lisa Blunt Rochester of Delaware and Representative John Katko of New York, one Democrat, one Republican. Bipartisan support for bill from the beginning is the best way to plan for success for legislation. And in the Senate, it was introduced by Kirsten Gillibrand of New York. It has 58 co-sponsors in the House and 4 in the Senate. This bill, the Workplace Violence Prevention for Healthcare and Social Service Workers Act, would direct the Secretary of Labor to instruct OSHA to issue a standard requiring healthcare employers to have a plan in place to prevent violence from happening in the workplace and respond when it does. And it would authorize current OSHA standards be made mandatory, matching standards in operation at the state level. This bill was introduced in the House by Joe Courtney. There is no Senate companion bill. So if you're paying close attention, you may have noticed that one of the successes I noted for last year was that this bill passed the House. It has not yet passed the Senate. Because there's no Senate companion bill, I can't give you a Senate bill number, just a House bill number for now. The Senate has the option of voting on the House bill. Legislation takes one of two routes to eventually pass and become law. It has to pass both the House and the Senate in the same form, the same wording. Often members of the House, members of the Senate coordinate with each other. That coordination is often facilitated, frankly, by associations like our own, to simultaneously introduce the bill in the House and the Senate. No one was ever able to recruit a Senate sponsor to introduce a companion bill there. So it remains as just a House bill, but the Senate can vote the House bill now that it has passed. Last year at our program AWHONN Capitol Hill, AWHONN members lobbied for this bill, and it passed actually shortly thereafter by a good bipartisan margin, 254 to 166. And I know that's bipartisan because there's only 217, I think it's 217 Democrats in the House. So to get to 254, it would have had to have been both Democrats and Republicans that voted for it. Again, bipartisan support, really key to getting legislation passed, especially now that this bill is going to the Senate. I'll talk more about AWHONN on Capitol Hill in a minute and our further efforts to pass this bill. So the Mothers and Offspring Mortality and Morbidity Awareness, or MAMAS Act, would provide technical support to states and healthcare providers to combat the rising maternal mortality and morbidity rate, and provide grants for healthcare centers to implement best practices and expand the definition of postpartum under Medicaid, ensuring that women receive the much needed healthcare. And it would standardize data reporting, allowing researchers to understand the larger causes of maternal mortality and morbidity, and allow professionals to develop and implement safety practices. A couple of things I want to point out to you about this bill. You might be noticing kind of cutesy names with the acronyms, right? We have the MAMAS Act and the PUMP Act.
Yeah, can we add 8, please?
Could everyone just please mute their line so we don't get any interference? That's a trend. It's not a requirement when writing and introducing legislation.
Can you give me a card with his name on it? Thank you.
The other thing I want to point out about this bill, it was designed to be the next step building on the Preventing Maternal Deaths Act, something we worked hard to get passed, that did pass in 2018. That bill created a grant program for maternal mortality review committees. That program is based at CDC. And that program, that bill, has been successful in prompting more states to create maternal mortality review committees, and in fact to upgrade their maternal mortality review committees to meet the requirements in that bill. So this goes the next step. It would create a technical assistance program, again housed at CDC, which would be gleaning that technical support from the reports filed there by state maternal mortality review committees. And then it supports that technical assistance with grants. And then in my opening about why AWHONN advocates, why we have to go ask the government to do things, I mentioned the example of extending Medicaid coverage to 1 year postpartum. This bill, if it passes, would require that. So some really important policies here in this bill. This was introduced in the House by Robin Kelly. It was written in Robin Kelly's office. I had some conversations during that process with the staffer who was working on it, and introduced in the Senate by Dick Durbin. Robin Kelly and Dick Durbin are both from Illinois. It has 59 co-sponsors in the House and 10 in the Senate. And again, I'll speak more about what we're going to do further to pass this bill in a minute. So here we have the Family and Medical Insurance Leave Act, or Family Act. This would provide paid leave for 12 weeks for any family member for any family-related medical leave, including maternity care. You are probably familiar with FMLA, which allows you to take leave for yourself or for a family member, including maternity care. But of course, FMLA leave is unpaid. And that puts a big financial burden on a lot of folks. And frankly, it prompts a lot of new moms to go back to work sooner than they should, both for their own health, also for that of their baby. And it's particularly an issue when it comes to breastfeeding. AWHONN supports the science on breastfeeding and recommends that moms breastfeed for 6 months. But the financial pressure on mom and her family to go back to work is the biggest thing that interferes with breastfeeding for 6 months. So we support this bill because creating paid leave for FMLA leave would make it financially feasible for more new mothers and fathers to stay at home with their baby and focus on breastfeeding, as well as infant care, as well as care for mom for herself, so that she makes those follow-up appointments and seeks the medical care she needs and gets the rest she needs to recover. This was introduced in the House by Rosa DeLauro of Connecticut, and she collected her co-sponsors for the most part before introducing it. So it had 202 co-sponsors at the time it was introduced. It's up to 205 now. It was introduced in the Senate by Kirsten Gillibrand of New York with 37 co-sponsors. Here's the PUMP Act. I thought I'd already spoken about this. So this is providing urgent maternal protections, or PUMP, for Nursing Mothers Act. There was a law passed several years ago that required employers to give wage or non-exempt employees break time to express milk during their workday. The bill did not cover salary exempt employees or salaried employees, on the assumption that the flexibility inherent in being an exempt employee gave them the break time they needed to express milk. That turns out not to be the case for some professions. So this bill would expand that break time requirement to exempt employees, while also requiring the employer, in fact, to provide them with the space to express milk. It has 5 co-sponsors. The House companion bill has already passed in October. I think that was in my slide on our successes in 2021. And so we are pursuing getting this bill past the Senate so it can be signed by the president and become law. I wanted to tell you something about one of our resources we have that helps you to become involved in advocating for the bills that we've just talked about and the other policies that AWHONN supports. We do have an online action center on our website. And again, I've given you the trail of breadcrumbs at the top of the slide to find this. We have some alerts written here. If you click on the first one, or any of them, there's more than just the one, you'll get some background on the bill. It will tell you whether or not your members of Congress are already co-sponsoring it. And if they are not, it will give you directions on how to call your members of Congress and some talking points to use in that call. We ask you to call rather than email because repeated surveys of congressional staff have indicated that they are suspicious of the validity of emails, but that is not a problem with phone calls. And they will ask you where you live to verify that you're a constituent. And they might ask you some other questions. and it's a good opportunity to connect with your elected officials. So I encourage you to look for that. We do also send out announcements by email when we have a new alert that we'd like you to take action on. Another member opportunity to become involved with advocacy is our program AWHONN on Capitol Hill. It's coming up in less than 2 weeks for this year. Registration has closed, so if you're just now learning about this, I hope that you will consider participating next year. But it is unfortunately too late to get involved this year. We do have to have a lead time of a few weeks to close registration before the event, because we have to make appointments for every participant to speak with staff in the offices of their U.S. senators and U.S. representatives. But we do provide folks with a full day of briefings to prepare them for those meetings. And then, as I say, we make appointments for you, and we provide fact sheets and talking points, and even a follow-up letter to send. This program has been very successful in recruiting new co-sponsors to bills. So it's something I follow up on every year. We sometimes get a few on some bills. We sometimes get a dozen or more on others. And of course, last year we saw the workplace violence bill gain a lot of support and even get a vote in Congress shortly after AWHONN on Capitol Hill. This year, the bills, I've already spoken about these bills, but here's the bills we'll be doing, that folks will be lobbying for during AWHONN on Capitol Hill. So I mentioned that we'll be doing further work to get these bills passed, and this is what we'll be doing. We'll be sending folks to speak with staff from the offices of their members of Congress and asking them to support these bills. Another way for you to get involved, I mentioned earlier that we have, for most sections, legislative coordinators. I have a list here of states where we don't currently have a legislative coordinator. If you live in one of these states and you'd like to be more actively involved, please email me at schase@awhonn.org. I'd be happy to talk to you about stepping into the role. Ultimately, it's up to the section chair to designate a legislative coordinator, but I'd be happy to talk to you about what would be involved in taking on that job. We also have a handbook for activists, specifically meant for legislative coordinators, but it's relevant really for anybody who wants to become more actively involved. You've got here the link to download it, as well as the trail of breadcrumbs to find it on the website. And one of the things you'll find in that handbook is job description for legislative coordinators. I often call on legislative coordinators to reach out to particularly their senators, or to help me find someone to reach out to a U.S. representative. We always want to have someone who lives in the representative's district make the contact. Those are the people that elected officials give most credence to. But also, legislative coordinators can take on the role of working on legislation in their own state legislatures. And some of you may be aware there has been a trend in the last few months of states passing increasingly restrictive state laws on abortion care. And I do not have the capacity to work on state legislation, but I'm happy to speak with anyone who wants to work on those bills. AWHONN, of course, our position is that providers should be able to freely talk about abortion with their patients. So I'm happy to talk to people who want to work on that and help you understand what you have at hand and what we have for advice to give you in the legislative handbook. This trend, by the way, of states passing restrictive legislation on abortion care, most states have a short session, a short legislative session. There's even a couple of states that only have a legislative session every other year. And for most states, it's their sessions are in the winter or spring. So you're probably seeing a lot of activity now that a couple months from now, it'll seem like there's no activity anymore in that respect, but it'll come back around next January or so. So it is not over. So we can take questions now. I think we're only 30 minutes into the scheduled time for it, so plenty of time for questions. And what I'd like to ask people to do is on Zoom, there is a raise your hand function, and then I can call on you, and that way we don't have people talking over each other. So if anyone has a question for me, if there's anything that wasn't clear or that you missed or whatever, go right ahead. I do see we have some people who are called in rather than on their computers. So since no one seems to be raising their hand, there's a hand. Tracy Weaver, go ahead.
Hi, Seth. I was wondering about when we were speaking about like California, that's where I'm from, California, issues. Before we speak on those on behalf of AWHONN, do we get in contact with you and make sure that it's something AWHONN National would support?
Yeah. Yes, please do that. I do try and clear those quickly. The position statements and the positions in the legislative priorities apply just as much to legislation in your state legislature as they do to legislation in Congress. And by all means, take a look at those on your own to see if it's there, but please check with me and I'll verify that for you. And we can also have, as I mentioned, a conversation about how best for you to pursue either passing legislation or blocking it, depending on how it impacts an AWHONN position. Thanks for asking that question, Tracy.
Thank you.
Anyone else? If you're someone who's only on the phone and you have a question, go ahead and just speak up. Well, I see some names I recognize from registration for AWHONN on Capitol Health, so I'm looking forward to speaking with you more in about a week and a half. If you're a first timer, I hope you really appreciate the program. People seem to have very positive feedback generally about it. I must have given a very thorough presentation because I don't see any more questions. In that case, I'm happy to give everyone some time back in their day. Thank you so much for attending. I do see some chats. Let's look in the chats. All right then. Thank you, everyone, for taking the time to view today's webinar. And again, feel free to email me, schase@awhonn.org, if you think of anything following up that you'd like to ask more about. All right. Have a good day, everyone. Bye.